So the Grace Centre is a newborn intensive care unit based at the Children's Hospital at Westmead, and we look after some of the sickest babies in the state of New South Wales, and they come to have cardiac surgery, general surgery, or they may have very complex medical conditions that require the services of a children's hospital.
In this particular place, we have access to all of the specialties within a tertiary referral centre, and so we can bring all of the resources that we need to look after the most complicated babies.
In the past, the survival rate in the Grace Centre was 83%, so that meant that 17%, or nearly 1 in every 5 babies, died. But for the last 2 years, our survival now has increased dramatically. It's over 97%.
Yeah, at my 20-week ultrasound we found out that she had a heart problem.
Yeah, she had a surgery at 2 days old and he's going really well. She's 3 weeks old. If anything goes wrong, we know that this is the best place for her to be, and there's everything she needs here. From, as you said, from equipment to nurses, doctors, everything, specialists. So she's got a future.
We're always looking for funds, and we buy medical equipment with the funds.
Clara's on a transport bed, so it's a whole system with everything in one bed, and this means that the babies can be admitted onto this bed and then go to theatre on it and come back from theatre on it, and they don't need to do a lot of moving around. Well, we need all these equipment so we can provide her with the help that she needs, so we can help her breathe and we can provide her with nutrition, and so we can help save little lives.
As well as just having our patients survive, we're quite concerned about what their future holds, and that's why we're very interested in following them up. So traditionally, along with other units in New South Wales, only followed those babies that were very premature or very small. But given that most of our babies are big babies with cardiac and surgical problems, in recent years we've been following those as well, and they have quite a few problems. And we'd really like to be able to expand our clinic to follow all the babies who need following.
We need to build a purpose-built clinic that we can monitor the children in, and that will be staffed by a developmental paediatrician, an audiologist, a speech therapist, a physiotherapist, an occupational therapist. And when they work together in a group, this multidisciplinary follow-up can identify problems early and then provide the best early intervention.
Harrison was born at 6:10 yesterday morning. My wife Lisa got to hold him for about maybe 5-10 minutes, and from there they recommended that we take him to the special care unit just because his colour wasn't right and he was struggling to breathe. He had a hernia, so there was a tear in the diaphragm. So he's currently in getting operated right now, so fingers crossed, please God, he's going to be okay. You don't know until you walk down these halls and see how many sick kids, and until it's one of your own, it really hits home on how important this place is and how much we really do need this place. It's just amazing. We don't know where we'd be. The nurses have just done such a tremendous job, and we owe them a lot. They've been great, and we won't forget it.
Look, the best thing about our jobs is that we can rise above ourselves. You know, you're just an ordinary person. You know, you have a family. You know, you're sending off your kids to school, trying to worry about the washing up and the laundry. You come to work here and suddenly you're doing something that seems extraordinary. It is. You're being allowed into people's lives at the most vulnerable time to look after the most precious person, their baby. They trust you to do that, to do the best that you can, and it really makes you better than you are.